While statistics about overdose deaths from the opioid epidemic continue to dominate headlines, other debilitating and costly problems have been creeping up in the shadows. From PBS station IdeaStream in Cleveland, Kay Colby reports on an increase in deadly heart infections among IV drug users, a little-known problem with big-time consequences for individual patients and society as a whole. It's part of our ongoing series, America Addicted. And a warning, some of the images and photos you're about to see are graphic.
These images capture fallout from the opioid epidemic among people who are homeless in Chicago. They're part of a photo essay by Lloyd DeGrain, published by Belt magazine in 2017. At times, heroin injected into the veins of users can lead to dangerous infections, like the one that killed this 34-year-old woman. Almost 350 miles away, Cleveland Clinic surgeon Jose Navia is prepping for an operation to keep a similar infection from destroying the heart of a 31-year-old mother.
It's a very difficult case. Hopefully we can do in the right way. And then we like to replace the valve of the aortic valve and then repair or replace in the mitral valve.
The human heart has 4 valves, including the aortic and mitral valves. Each valve opens and closes with every heartbeat to control blood flow in certain directions. Clumps of bacteria can attach to the flaps of valves, forming nodules of pus.
And so the valve is literally being eaten alive by the bacteria. It eats away the tissue around the valve, and it is very difficult, almost impossible to cure with antibiotics.
Cleveland Clinic's head of cardiovascular medicine, Dr. Stephen Nissen, says for people addicted to opioids, the pathway to deadly heart infections often begins with a dirty needle or polluted drug.
The heroin itself is not sterile. You know, the addicts have learned they will cook it. They'll use a flame to heat it up, but that doesn't generally sterilize it completely. And so you're repeatedly injecting bacteria into your bloodstream.
Green towel, please.
It's not long before Dr. Navia confronts the full wrath of his patient's infection stemming from IV drug use. All 3 flaps of the aortic valve resemble tiny pieces of Swiss cheese.
This is another perforation. Shouldn't be this way, should be completely closed here.
With the aortic valve completely destroyed, Dr. Navia opts to put in a replacement made of cow tissue. After running a series of threads through it, he puts it in position.
And this is a new valve.
With hands that mimic a keen knitting needle, he secures it in place. The cost of open heart surgeries like this can run over $100,000. Many patients come in with lots of complications, requiring days or weeks in ICU. Studies show cases of infective endocarditis, which is the medical term for infected heart valves, are on the rise among younger adults, mostly due to the opioid epidemic. 3 of the 21 occupied beds in the clinic's cardiac ICU are currently filled by endocarditis patients suffering from IV drug use.
That's very typical. It can be more, it can be less, but that's a pretty good average. These days, that's what we see.
So what is that telling you?
It's telling you that this is an epidemic that is just out of control.
The Cleveland Clinic says in 2014, 10% of its endocarditis patients undergoing surgery were opioid dependent. In the first 6 months of 2017, that percent was 18.5. Research elsewhere shows a similar trend. A study at 2 large Boston hospitals found between 2002 and 2014, their percent almost doubled. The Boston study also found poor long-term results for those patients. Cleveland Clinic infectious disease chair Dr. Stephen Gordon says their research found poor outcomes starting about 3 months after surgery.
From 90 days to the 6-month period, the risk of readmission or reoperation is 10-fold higher amongst the opioid use disorder patients with endocarditis that were operated on. And we believe that is most likely due to relapse.
Experts say those suffering from opioid addiction face high rates of relapse, which often means reinfected valves and repeat surgeries. Many patients are on Medicaid or lack health insurance altogether.
We have seen a fairly significant number of patients that have had not 1, not 2, but 3 or 4 heart valve replacements related to repeated use.
Bioethicist Mark Alicio says repeat cases raise some thorny ethical issues. He and others argue addiction treatment needs to be part of the heart care protocol for such patients.
There's really got to be comprehensive care for patients who have this issue, because if there's not, you're going to put them through a lot of pain, some suffering, a difficult road for little and in some cases maybe no benefit.
Gordon says the Cleveland Clinic now includes addiction treatment up front for endocarditis patients who use IV drugs.
We want the addiction specialist up front, similar to we would have our other subspecialists up front in the care for this patient. And if it's indicated, medication-assisted treatment, then no barriers to getting started in the hospital, which is relatively novel, but a lot of hospitals are looking at that.
Public health advocates say these cases also point to the need for more harm reduction programs, like distributing clean needles, as well as devoting more resources to addiction treatment. Again, Professor Mark Alicio.
You don't have to care about any individual drug user one lick to know that it's in your interest for society to focus on prevention and harm reduction. It's a lot cheaper to prevent endocarditis than to do a valve replacement.
Good suction to me.
About 3 hours after scrubbing in with the second valve repaired, Dr. Navia weans his patient off the heart-lung machine.
The heart is managed by his own, and the two valves, the aortic valve that we replaced is working fantastic, and the mitral valve repairs also, so the heart is getting a normal function. And she did very, very well so far, so I'm very happy. Came off the pump without any problem. And then, so we'll see what she's recovering, but I'm very happy with the results so far.
While this surgery succeeded, big societal questions remain. And according to Stephen Nissen, so does the human toll.
If we don't cure the heroin addiction, then we haven't solved the problem. And that's where we stand. The legacy of this is going to go on for decades. It's a ripple effect, and it keeps on growing.
For the PBS NewsHour, I'm Kay Colby in Cleveland.